Hi, this is a SIMBIHealth advocacy video on sexual health. My name is Dr. Helen. In this video, we'll be discussing common myths and problems in sexual and reproductive health, as well as presenting solutions. Get ready to be educated and enlightened. We'll start with common myths in sexual health. Number 1, the best way to avoid getting pregnant is to use condom. Fact. The best way to avoid getting pregnant is through abstinence. Abstinence is the only form of contraception that is 100% effective. 2. Peeing or douching after sex can prevent pregnancy. Fact. Not only can douching not prevent pregnancy, it can also lead to infections. Myth. A girl can't get pregnant if she's having sex for the first time. Fact. A girl can get pregnant even if she's having sex for the first time. I'm very sure you've heard some of these myths and you know more. Now you know better. The United Nations reported that less than 1 in 4 people made use of contraceptives in West Africa. In the same vein, in 2013, the Nigerian Demography and Health Survey discovered that only 10% of married couples, or married women rather, within the reproductive age, that is between 15 and 49, are using a modern contraceptive method, with wide disparities among the different regions in Nigeria, and this is a very low number. Also, according to the WHO, at least 10 million unintended pregnancies occur each year among adolescent girls aged 15 to 19 years in developing countries. Additionally, 3.9 million unsafe abortions among girls aged 15 to 19 years occur each year. So pregnancy among the adolescent age group, that is between ages 10 and 19, is a worldwide problem, and it is even more common in middle and low-income countries where a lack of social empowerment and access to accurate information on contraceptive methods are huge contributing issues. And these pregnancies, that is teen pregnancies, result in complications to both the mother and the child, and this is because of their underdeveloped bodies, which cannot adequately support a child. These girl mothers suffer stigma and rejection, so much so that they are unable to complete their education and drop out of school because they have less employment opportunities. And because of that, rather, they have less employment opportunities and are prone to poverty. To avoid the stigma of being a teenage mother, some of these young girls get rid of the pregnancies, but usually end up getting unsafe abortions. And these abortions are either carried out by people without the right skill or in a non-conducive environment. As you can imagine, complications from unsafe abortions, which can be life-threatening, abound. And it's quite vital to prevent unsafe abortions. Adolescents need to have access to effective contraception and sexuality education for this to be achievable. Family planning services include the ability of individuals and couples to anticipate and attain their desired number of children, including the spacing and the timing of the births. It is achieved through the use of contraceptive methods and the treatment of involuntary infertility. Contraceptive methods can be broadly classified into many groups, including barrier methods, that is, those methods that prevent sperm cells from reaching the egg, and methods that prevent ovulation, such as the birth pills, the birth control pills rather, and methods that allow the fertilization of egg but prevent the implantation of the egg inside the uterus. For example, IUDs, that is intrauterine devices. Now, what can be done to help this situation? Number 1, early and age-appropriate sexual education, that is encouraging a safe environment where adolescents are not afraid to ask questions about their sexual health. 2. Since the available statistics show that sexual health situation in Nigeria is poor, there is need for more sexual health advocacy groups, and this need is urgent. 3. On a longer term basis, females should have access to appropriate sexual support and empowerment to enable them to make their own decisions about their bodies and futures. Okay, again, on a longer term basis, females should have access to appropriate social support and empowerment to enable them make their own decisions about their bodies and futures. To conclude, safe sex is an act of self-love, and this was said by Mia Yamanouchi. So you should take responsibility for your sexual health and help enlighten those around you. Thank you.